Hello, hello. Okay, I'm your host, Dr. Johnson, and waiting on some people to join us. Hope you had a wonderful day. Tomorrow is Friday. I don't know about you, but I'm very excited. Okay, so let's get started. Welcome to the Gorgeous Glow Skin Show. I'm your host, Dr. Sonia Johnson. I'm a board-certified dermatologist and creator of the GRxSystem. I help women who want to have even and clear skin tone with increased confidence. If that's you, you're at the right place. So today we're going to talk about what is that bump on my face? So I have a lot of people that come in, and sure enough, they have questions about strange lesions that are growing on their face. And usually they're in the ages of 35 to 60. So, and at that age, we tend to start growing things that usually are benign, but nevertheless, they come in and want to know what it is. And of course, they would like those lesions removed. So today we're going to talk about one common lesion that we see a lot of times around the eyes, but I'm starting to see a lot of women who just have them a lot of little bumps on their cheeks and some on their forehead. And those are called Milias. And we spell that M-I-L-I-A. And of course, if it's more than one, with an S. And Milias are little bumps that are actually small cysts. And so as you know, sebaceous cysts or inclusion cysts are it's a sac. And if you think about your skin, and what does your skin do? It produces oil and it sheds dead skin. So if you take your skin and roll it up on itself, we call that a sac. And usually that's underneath the skin that we see as skin. They're called cysts. Or when they're very small, less than 1 centimeter, we call those milias. And so milias are a little bump, usually underneath the skin. Within a sac there's oil and dead skin. And so when they're bigger, larger than 1 centimeter, we call those cysts. Okay. So how we treat milias? Milias again are benign. And how we treat them, I usually take a little blade, nick the skin, and then use a comedone extractor and extract it out. Okay. Now when they're very small, like 1 millimeter, or they're on the eyelids, I cannot extract. All I can do is nick the skin. And usually the tip of my blade, I use a very short blade. I can sort of tease it out with the blade. Unfortunately, sometimes there's a little connective tissue holding on to that sac, and so it's hard to tease out, but we do our best to get it out. But regardless, you can get new ones. So the lesion that we remove is gone for good, but you tend to make more. Now, what I've seen, especially when I see a lot of women who have a lot of these milias scattered on their face, I've seen is usually due to their moisturizing products or the fact they, some type of occlusion. So if they put their hands on their face all the time, they tend to get little milias. Or if they use heavier moisturizers. So I recommend that they go to a lighter a moisturizer that is not as heavy in oils or ingredients that can clog the pores. But regardless, we treat them the same. So they have all these little nicks on their face. And of course, the face is bleeding from the procedure itself. But the face heals up very well without any scarring. And that's normally how we treat the milias. You can use extractors, exfoliators, such as your retinoid products, but that takes a very long time, if even gets rid of the problem. So a lot of times we just go ahead and do the procedure in the office. But they're benign, nothing to worry about. It's just more of a cosmetic nuisance. And you can get more, but it's not always the case. A lot of times people have maybe 1 lesion, very common around the eyelids, but you can also get these lesions on the other parts of the face, like the cheeks, as well as the forehead or chin. Any questions? Great. Well, you all have a wonderful weekend. And again, I'm your host, Dr. Sonia Johnson. I'm a board-certified dermatologist and creator of the GRxSystem. I help women who want to have even and clear skin tone with increased confidence. Join us, our Facebook group, GorgeousGalCrew.com. GorgeousGalCrew.com. Take care.